Hey guys, it's Luke Deckard, founder of Back 9 PT and Performance here. Today we're going to talk a little bit about one of the most common areas of pain in the golf swing, which is the hips. So we're going to go over a few of the most common things that I'll see people present with to me, as well as a few modifications that we can do in kind of our setup to help eliminate that pain that may be occurring. But before we get into all of that, I want to talk just a little bit about hip pain. So, in the golf swing, we need a good amount of external rotation and internal rotation for both the lead side and the trail side. So, when we do not have an adequate amount of this, the most common injuries we see are labral tears, hip impingements, which there's a couple variations, and then trochanteric bursitis. So in general, what we do when we're trying to figure out if something is hip pain or maybe even from the lower back is we do what's called a C sign. So you make a C, you kind of put it on that bone on the outside of your hip. It's called the greater trochanter, and then you kind of go around. If the pain is in that region, it's generally going to be caused from the hip joint itself. We've actually seen if you have pain on the back side, that's most commonly to be associated with a lower back injury. But what's interesting there is over half of people that are being treated for the lower back actually have some hip pain or dysfunction that's occurring. So those are just some things to notice. Now we're going to dive into a few of the swing characteristics that I will see that likely lead to you having some hip pain. So the first swing characteristic I want to talk about is actually just having too square of a stance. Now that may sound silly, but if you get your stance too square at setup, we're actually going to limit your ability to have hip internal rotation on the backswing and then internal rotation on the follow through. So the general setup that most teachers will say is get your right foot square and then let your left foot or your lead side a little bit open. So what that does is actually, still on the backside we don't have a ton, but that gives us a little bit more room here and definitely more room to get through on that lead side to get into that hip. So that's the number one thing that we'll see. The next characteristics we see actually come from parts of the swing. So what I'll see a lot of is instead of rotation, I'll see a sway, which is that in the backswing, or a slide in the follow through. Now, this is usually from not rotating in the swing. So that could be actual mobility limitations in those hips. It could be stability limitations, and some of it is even just poor setup. So that's some of the big things that we'll notice here is that swaying and sliding and how that can affect the hips and cause pain. When we actually sway, which is more on our backside, our hip goes into more adduction, which causes kind of that impingement feeling into your trail side. The same thing can happen when we slide in our follow through as well, as that gets the adduction on the lead side now, and it can have pain caused into the hip joint. So the big things with these is we make sure mobility is good, and then we need to strengthen and learn the neuromuscular patterns of being able to move lower body and initiate with that instead of coming over with the upper body. So making sure we have that is huge. Now, one of the other things we'll see commonly is people set up in, we say, S posture. So S posture in itself, with the anterior tilt of the pelvis, will actually limit your hip mobility just due to the pure anatomical spaces that it takes, kind of takes over when we get into that position. So if you're in an anterior tilt and in that S posture, you're not going to be able to rotate your hips as far as you normally could if we get more neutral. So again, some of this is it a true mobility limitation, or is it a stability or motor control issue that we need to address and just help you learn? That's where further screening and everything can come in to help us take care of that. Now, the last thing I want to talk about is just a modification or two that you can make in your swing that will help free up that hip mobility and allow you to feel more of that rotation if it is something that you're limited with. So the first thing we can do is you can set up in that normal posture. Again, let that lead foot flare so that you're going to have more there. But then you can even just flare out the trail side as well. What this does is allows me to rotate further back in there and actually feel that like rotational coil in the like back pocket of my trail hip, so that then I can like come over here and fire into my lead side. Again, we don't use much external rotation on this side because I'm gonna come through. And having our lead side already set up open is gonna allow me just to have more ability to rotate into that side as well. The common thing or worry that your teachers may say is that your alignment, because when I go from kind of here and I open that trail side, it does tend to look now like I'm aimed out to the right of my target. So you as the player just have to know that if I just set up normal and then I kind of flare out both feet, I'm still on my target line, and now I can proceed to swing like normal and knowing that I'm not way out to the right, or if we do the other way out to the left. So it's just one of those things, set up normal, then toe out. And that's gonna give you, that 20 to 30 degrees of internal rotation that we need on both sides. So if you're struggling with swaying or sliding in your swing, or just feel like your hip mobility is limited, give these guys a try.